My next up is Kelly Depcik and Bill Coughlin on the prescription benefit.
Yes.
Hi, Kelly.
Hi. Good afternoon. Can you hear me?
Hey, Kelly.
Okay. Happy first day of spring.
Hey, you too.
Happy first day of spring. Thank you very much for allowing me to be here this afternoon with all of you. I really want to say thank you, especially to Mr. Wells, to Denise, and to Iris. Thank you very much, and to all of you out there. So there he is.
Kelly, keep them jars coming, girl. Keep them jars coming.
And hey, I also jotted down that attorney's number.
I'm gonna tell you, girl.
Oh, and my boo. You guys, some of you know my boo. I'm not the attorney. Anyway, so again, thank you very much. Let me ask you this. Do I need to put the presentation up, or do you show it? I'm sorry.
Yeah, we'll show it.
We'll show it. We're going to share it.
Okay. All right, great. So I see a question already from Mr. Reyes about how to get a new ID card. So Mr. Reyes, you should be able, I'm sorry, maybe it's Ms. Reyes, I apologize, but you should be able to do it through the website, the Express Scripts website, or you can call Express Scripts on the number on the back of your ID card. You should also be able to request a new ID card through the mobile app. You can also just send a message to Iris and she can take everyone's questions or request, if you will, and email those to me, and I'll make sure that you get a new ID card. So one of the things I wanted to talk about this afternoon, I'm not going to take a lot of time, but that is Express Scripts is always continually trying to empower you so that you can manage your medications anywhere, anytime, right? So we have invested a lot of money in continually making improvements to our website for our members and to our mobile app. Our website, the address is just express-scripts.com. And if you register with the website, your username and password, you can use that same username and password to register with our mobile app. Of course, both are free of charge. I think I heard when I first joined a couple minutes early, someone was saying something about not wanting to give social security numbers or sharing social security numbers. I don't blame you. So when you register with our website or even with the mobile app, you can just use your member ID number on your member card, your Express Scripts card. If you go to our website, the Express-Scripts website, it's very simple to register. And you can do virtually anything on the website or on the mobile app. One of the things that I like the most I actually really like the mobile app. I use the website a little bit, but I really use the app a lot more frequently. It's just simple and easy. And I am honestly, genuinely, I am not the most savvy when it comes to technology. If I see one more remote in the living room, I think we've got like 3 remotes for the TV and everything. I can never figure all that stuff out. I really can't, but it's the same way with the phone and everything else. And the website, I struggle with that. So the only reason I share that with you is because I actually use, like I said, more so the app than I do the website. And it really, truly is simple. What you can do on our website, you can do on the app. So again, you can go to express-scripts.com and register. It's very simple. Or you can download from, if you have an Apple phone or Android, iOS services, you can go to your app store, if you will, download the Express Scripts app. It actually looks a little bit like, if you look on this slide, you'll see on the bottom where it says, you'll see like the phone, right? And at the top, you see the blue E. That's actually what the app looks like. You download that and you can register, again, use your same username and password that you have with the website if you're already registered with the website. Otherwise, again, it takes just a couple of seconds to register with the app. And there's also touch verification if you want to just, I always like with the apps, I do the facial recognition. You can do that with the Express Scripts app as well. One of the things I'll tell you, just to tell you how I use the app, okay? I use the app because I order my refills through the app. It's just literally a couple of clicks. Once I order my refill, then I'm anxious and I'm like, where is it? Where's my drugs? Has it left the building? Has it left the home delivery pharmacy? Is it on the way? I check again, a couple clicks, and it'll tell me my order is processing, or it'll tell me my order has shipped. It'll give me tracking information. It gives you everything so you can see exactly where your prescription is as it's making its way to you. The other thing on the app, you can easily, if you want to look for a retail pharmacy in your network, it has GPS capability and everything. It'll tell you which pharmacies are in your network. It'll even give you the direction as to how to get to the pharmacy. So you can order refills, you can track your status of your medication as it's en route to you. You can find other retail pharmacies within your network. You can compare prices among pharmacies, including Express Scripts Home Delivery. So you can price compare. You can change your payment status. So if you have a credit card on file, right, with Express Scripts with home delivery, if you want to change your credit card status or payment method rather on your app or on the website, you can easily do that. It takes just a couple of minutes. You can pay your bill on the app. If you've got an outstanding invoice, it's a couple clicks and it's paid. If you need to update your address or anything like that, you can do it on the app. If you have other benefits with Express Scripts, so for example, Pika, if you take any specialty medications, you can also see those medications in the app and on the website. You'll see where it says, like on the app, it says account settings, and then it'll say additional benefits. And if you click there, you can see if you have any other benefits with Express Scripts, it'll be listed there, and you just click, and then you should see your medications there too. So if you go to the next slide. Yeah, this just really kind of reiterates some of what I've already shared with you. Essentially, really what I want to tell you is don't be intimidated at all by the technology or the app. It's really simple and easy. It also works very well. Some apps I've used, sometimes they kind of fizzle out or don't work really well, what have you. Ours does. We have poured a lot of money into the app. It's got like a 4.7 out of 5-star rating. It's the highest rated app for a PBM for members out there. And we continually are making improvements. So if you've got questions, let me know. Any questions whatsoever, please let me know. But I just really wanted to make sure that you're aware about our mobile app and about the website and about how I think it can save you a lot of time and energy and effort just by using those two tools. The other thing too, before I forget, is that, if you've been obtaining a medication at retail, like a maintenance medication, and you'd like that medication maybe to be delivered to you using Express Scripts Home Delivery, again, it's just a couple of clicks on the app and you let us know that you want it to transition to home delivery, and we'll take care of that for you. We'll work with you to get that done. So do you have any questions for me? And I want to be mindful of everyone's time. So I don't know the best way to do this, but I'm happy to take questions, or if you want to send them to Iris.
Andrew Sokolov.
I'm sorry?
Andrew, do you have a question?
Hi, thank you. Yes, thanks for presenting and explaining how the app works as well. I just started using it.
Okay.
I have an anecdotal situation, but I don't know if there's actually like a schedule for prescriptions, especially for inhalers. I have asthma.
Oh,
Uh,
okay.
Kind of been rationing my inhalers because I'm being charged like $100 with the Express Scripts
Okay.
for an inhaler, and
Okay.
I don't know if that varies, but a schedule or something that can help me maybe find an alternative to use that's cheaper, I guess, is my only option.
Yes, absolutely. So the one thing I would recommend that you do, it depending on, are you obtaining it through retail?
Um, well, it goes to my local CVS pharmacy. Yeah.
Okay, all right. So what I would do, if I'm correct, I believe you have your copay is like 30%, and then you're subject to either like a $30 minimum copay, maximum $500. So 30%, I would
Okay.
be, and I'm sure you've probably done this, I would shop around and compare prices at different pharmacies. And 371 is in our broadest, largest pharmacy network. And so you definitely can find different prices depending on where you go to obtain that medication. If you have questions though about alternative inhalers that you can use, what I would do is actually I can put you in touch with the pharmacist on 371, Shardul Patel. I can have him call you. He actually oversees everything, all things clinical for 371. Or you can call the number on the back of your card, and we can always put you in touch with a pharmacist 365 days, 24 hours a day. And even through the app and the website, we can connect you to a pharmacist. I don't know,
Got
and
it.
I want to make sure, did that answer your question? I'm sorry,
It did.
sir. I
It
want to
did.
make sure
Thank
it
you.
did.
I'll try those avenues. I'll try calling personally, but thank you for that. Yeah, that helps. I'm gonna go down that avenue.
And if for some reason, if you hit a roadblock, or you're kind of, just let Iris or Denise know, and they'll reach out to me, and I'll help you myself. We'll figure it out.
Thank you.
Absolutely.
Thank you, Andrew. Jay Gorman, you have a question? Jay?
Yes,
Omogo?
I'm sorry, I'm here. Do you hear me?
Yes.
Yes.
I'm sorry, I apologize. So Express Scripts, I mean, I appreciate the fact that you're here, but there have been situations where I've called Express Scripts in the past and there's been significant problems. Well, when I initially started with Express Scripts, I was on 3 medications. There was an automatic shipment every 3 months when my medication was going to run down.
Okay.
There's been situations where you guys have shipped prematurely, and I've asked them to change it to
Okay.
where I call and say, okay, I'm ready for my next prescription, and where I've ended up sometimes with double the amount of medicine that I need.
Yep.
And so that's been corrected. Then there's been other situations where I've waited to call for when I need a prescription refill, and you guys come back to me and say, oh no, your prescription is expired and that we cannot ship it. You're going to have to go back to your doctor and they've got to approve this. And what my question is really is, aren't you guys, or should you not be proactive in terms of when my prescriptions are running out? Shouldn't you be reaching out to my doctor and asking for refills before I call you and say, hey, in April 21st, I'm calling you and you're telling me my prescription has expired March 30th? That causes a lot of problems. I've had that happen 3 times in the past year. Is there something? Yeah, good. I'm sorry.
No, I apologize, sir. I didn't mean to interrupt you. I apologize. So actually, I'm really glad that you brought that up. 2 really good points. And so let's go back to the automatic refills. I'm really glad you mentioned that. That was something that I wanted to touch on. So I'm really glad you mentioned that. So with the automatic refills, what happens is you are in control. All of you are in control for each medication. If it's a maintenance medication that you obtain through Express Scripts, you tell us which medication you would like to receive those automatic refills for. And so it's at the medication level. So it's not like it's all or nothing, right? All of my meds have to have that automatic refill or none of them. It's in your control. If you look on our app or on the website, you'll see, or if you call customer service, whatever is your preference, you'll see that there's, like on the app or the website, there's a little button that you can, click on or check off next to each medication that you would like to have automatic refills for. Or if you don't want automatic refills. And the default is not that we're going to send automatic refills. That's not the default. So I know, Mr. Gorman, you said that you've got that resolved, and I'm very glad, but I did want to mention that to everyone else, though, that is all in your control at the medication level. You let us know if you'd like those auto refills or not. It's interesting because we've had, it's interesting. I had one experience where the client wanted auto refills turned off, that ability for all members turned off. And because one or two members were concerned because they didn't understand how to turn off that functionality. We turned it off, and the member noise we got, because it was turned off for the whole plan, was very high, very significant, because a lot of people actually do rely on that. So I just wanted to touch on that. But again, I'm glad you got that resolved. So, and I'm sorry, Mr. Gorman, can you just repeat your second? Oh, the refill. So when you're running out of medication, and if you don't have a refill on file, I think you're asking us to proactively reach out to your physician to obtain another refill. Is that correct?
Yeah, that's what he said, Kelly.
Okay, I'm sorry. I just want to make sure I got that correct. All right, so let me take that back, and I will follow up with Iris. Let me find out exactly what we do. We are always happy to reach. Typically what we do is we ask you if it's okay, with your permission, if we may reach out to your physician to obtain a new prescription or to obtain refills. But if you have just run out of medication and you don't have another prescription on file, let me just confirm, because I do not want to give incorrect information. And I'll be the first one to say, I don't know everything, but I'm going to make sure I tell you the right answer. Let me go back and let me just make sure, and let me see exactly how we handle that. And then I will follow up with Iris to make sure that she shares the correct information with everyone on that.
Okay, thank you, Kelly.
Absolutely.
Thank you. Next up, we're gonna have Omogo Wheeler. She's gonna provide you with some additional information regarding prescriptions.
I had a question.
Okay, Yvonne.
All right, good afternoon.
Good afternoon.
This has to do with Express Script. I had a problem recently about my prescriptions, but somebody's supposed to get back to me by Monday. But the thing is, they said I had two different numbers. My problem was with the EpiPen. I get it once a year.
Okay.
And for the last few years, at least last few years, I paid a reduced amount. I mean, it wasn't over $100, and I was so happy. So this year I got it, and it was, let's see, last year I got it January. This year I received it March. They told me I have to pay $120. And I said, why? So they said something about my deductible didn't start. But if I get this every year this time, why is it that I'm paying so much more this time than I've done in the last so many years?
Yes.
So they claim something about all of my medication should be under pocket because I get medicine under one, and I think my EpiPen is under another number.
Yep.
And I
So,
don't know what could be done.
yeah.
So I don't have to pay that amount, because that is ridiculous.
And I'm so sorry, ma'am. What was your name? I apologize. I missed your name.
Yvonne Prince.
Thank you very much for your question. So it just so happens I oversee the PICA account. So with the PICA program, PICA has an annual deductible per each and every life of $100. So you're going to have to pay that $100 deductible and then your copay. And they have simple flat dollar copays of $10, $25, or $45. That's at retail. So you're going to get hit with paying that deductible one time and then the copay. So I don't know if you obtain any other medications under PICA. I'm happy to look if you would like to maybe share your information with Iris, and then Iris can share your date of birth, member ID with me, and I can look into it. I'd be happy to do so. But
Because-
the $100 piece, that is the annual deductible with PICA. So if you hit that earlier in the year, right, then maybe if you got the EpiPen later in the year, but you already hit the deductible, then maybe you didn't pay, you just paid the flat dollar copay. I would have to just check in our system.
$10, but the thing is, if I paid every year, I mean, if I pay, say, $10 every year, and it's 2 months shy, 2 months over the time that I usually pay that, why is it that I'm paying so much? Because I got it in March. They said something about a deductible starts in July. That means every year I will be expected to pay over $100, and all my medication, it comes under 2 numbers. So I don't know if the other medication that I receive is under PICA, and then the EpiPen is under something else, or can it be all under the all under whatever coverage that I would not have to pay that amount?
Sure. So I can tell you, I don't know what other medications you take, but I can tell you that the EpiPen does fall under the PICA benefit, and you only pay a $100 deductible once a year, and it's as of 1/1. So as of 1/1 of every year, you pay that $100 deductible. It does not reset on July 1st or any other time during the year. It's only as of January 1st. You know, you start all over and you got to pay the $100 deductible. But what I'd be really happy to do is, if you want me to look a little bit more into this for you and try to give you a better explanation.
Right. I would like to follow up on it, because
Absolutely.
they said it was going to get back to me by Monday. They did call, but it was a spam number, so I didn't, I missed the call.
Okay, hi, Ms. Prince. I know that you have they said that they were going to get back to you at Monday, and I guess that may be one of the office managers here. You can always email me. My email is in the chat. iClark@sseu371funds.org, and I will relay your message to Kelly Depcik.
No. Wait. We do not, let me just say this to you. We're gonna try to help you. We do not control PICA. I don't want to take on duties that are not ours. We have nothing to do with PICA. They have listen, I want everybody to hear me. PICA is a city-run program. It's negotiated. I will bring the issue up when I do the MLC, but they can't, we got enough work. We can't, because PICA does not respond to you. So we're gonna try, Kelly can probably do more with PICA than anybody else, but the reality of it is, PICA is totally different. It's not our benefits. We have no control over this. These people have no control. I will bring the issue up in MLC in terms of rising prices. Yes, the copays for PICA and the prices for PICA have gone up, not just for the EpiPen. I've got other complaints about drugs going up, and that's been the PICA program. That's not in our program. I want to just be clear on that. So
what I don't understand is the 2 different numbers that my prescriptions are covered.
But listen to me, because one could be under, and we'll look at that. One could be under our drug plan. PICA only has very limited, okay, pharmaceutical injectables, asthma, the PICA, right? Every other drug comes from us. So you're gonna have 2 different numbers because there's 2 different systems, okay? So the EpiPen, as Kelly just said, goes to asthma stuff. As Jay said, I think asthma is under, if you use an inhaler, okay? Guess what? If you do, what's the thing for sugar?
Insulin.
If you do insulin by mouth, PICA doesn't cover it. If you do it by injectable, PICA covers it. So my only, and just wrap this up, folks, is that we will try to help you, but they cannot resolve PICA problems.
Okay, so I was just trying to understand it too, so I appreciate that.
Not a problem, Yvonne. So they will get back to you about the 2 numbers to clarify for you. But clearly you have 2 different numbers because one of your drugs comes with the PICA and the other drug comes under our plan. And our plan, we have not raised copays.
So in your plan, it doesn't cover the EpiPen?
No,
that's
the city, that's PICA. It's a city plan. We negotiated that through MLC, but that's not in the welfare funds. That's charged to the city of New York. And we pay for it on the back door. okay? Because I don't want to.
Okay, okay, thank you. Okay.
So, again, thank you, Kelly, for all the
Thank you,
information.
Yvonne.
You're very welcome. It's my pleasure.
Thank you. Thank
Yes.
you, Yvonne, as well. So
It's-
guys, I know that we are running a little late. I do ask that you be patient with us. We do have a couple of more topics that we want to touch on before we go. I promise you it'll be worth your while. We have some pretty big raffles coming up at the end. So if you stick around, you get what you get, what you get. I see you, Selma. All right. So next up, I see her ready. So next up is Omogo. She's gonna add on provide you with some additional information regarding your prescription benefit.
Good afternoon, brothers and sisters. I'm very happy to be here with you all. There's just one thing I want to give clarity on as it relates to PICA, to the sister who asked about the two different numbers. You get one prescription card from us and one prescription card from your health insurance. And that generally is the PICA card. That's where your injectables and chemotherapy and diabetic medication comes from. All others come from Local 371 with a different ID number. So I just want to make sure that everyone has clarity on that. As relates to our benefits fund, the fund, and I'm going to read specifically from our website and our benefits book so that you will be able to see exactly what I'm saying and be able to refer back to it. The fund will pay a maximum of $500 per prescription for a 30-day supply at a retail pharmacy. A retail pharmacy means CVS, Walgreens, Duane Reade. The fund will pay a maximum of $1,500 per script for a 90-day supply via mail order through the fund's prescription benefit manager, Express Scripts Incorporated. If both spouses, domestic partners are covered members, the fund will pay a maximum of $1,000 per script for a 30-day supply at a retail pharmacy and a maximum of $3,000 per script for a 90-day. So a lot of the times I get a lot of questions as to, well, why am I paying so much for this copay? Well, there are parameters. And let me just give you the specificity. The fund will pay the cost of the prescription for $500 up to $500 for a 30-day. Covered members and eligible dependents will fill a prescription at a pharmacy for a 30-day supply. Well, they will incur a copayment. There's a 30% or a $30 copay, whichever is greater for brand names, and a $5 copayment for generic. Some people say, I get calls all the time, well, I can't take the generic. Well, you got to pay the copay for the for the name brand medication. If you have specific or additional questions that you need clarity on, please feel free to call either myself or Laverne Taliaferro. Both of us are office managers in the benefits fund. We may be reached at 212-777-9000. My direct extension is 3098. Laverne, yours is 3054. I may be reached on our website or via email, owheeler@SSEU371funds.org. And you may also reach Ms. Taliaferro at LTALIFEFERRO at the same email address. That mind you, I write that every day. Okay, so the final thing, the one thing that I want to express to you all is that it's much more economical. Granted, I'm not pushing you towards this, but anyone who takes a maintenance medication, it's much more practical for you to get a 90-day supply in the mail than to go every 30 days to the pharmacy to get a refill. First of all, you get your medication before they run out. You have them always on hand, and you can manage your finances through the 90-day supply process. There are appeal processes that we can make, that as members that you can make if there are hardship prescription drugs that you need to take. We have a lot of members who take prescriptions where the copay could be as high as $15,000. Copay as high as $15,000. and the max we're gonna pay is 500. How I rarely see the outcome of those appeals because they're not appeals in-house, but there is an appeal process. I have to tell you that we, the benefit fund, we have never ever set the prices for the medication. You have to understand the manufacturers set the prices for the medication. I heard a sister earlier, well, why does it cost this much? We try to help you guys through the union, specifically Anthony Wells and the Municipal Labor Committee, to try to negotiate keeping those prices down, but everything is up. We have no control of it. But I know President Wells does a very hard job and speaks very strongly about trying to save the membership as much money as possible. The funds does not cover experimental drugs. Just to give you a sidebar story, I had a young lady who called me who needed a specific medication for an illness that she had. And the prescription for a 10-day supply was $40,000. But it was experimental, and she was upset because we didn't cover it. So the only thing we could offer her is that she would have to have her doctor to either, prescribe her a different medication that may resolve or mitigate or support her illness, or pay the $40,000. Now, that wasn't the best advice I could give her, but truth be told, we, the benefit fund, have no control. And I want all to remember that we have no control. I'm glad to hear from Kelly that she says that the members can print out their prescription card off of the website, which is wonderful. Because while we enroll members in the prescription fund, we automatically send out a prescription card. Oftentimes, because of the United States Postal Service, you don't get it. So you call me, I'm all about to get my card. I tell you, just give me the info and I'll give you the processing. So just so everyone will have this is public knowledge. It's on the website. The BIN number for every member and their dependents. The BIN number is
610014.
okay, I'm waiting to make sure y'all know it. 610014. Wait a minute. The group number, everyone, is SSEU 371. Okay. The ID number is the member's full Social Security number. The member's full Social Security number. Some pharmacies ask you for a PCN. There is no PCN associated with our prescription plan. If there's nothing else, that's my piece. Any questions you all have, please either put them in the chat, raise your hand. I'll be glad to help you out. Thanks a lot.
Thank you.
Thank you, Omogo.